right, good morning. It is March 11th, I believe, 2020, and if you watched live spine surgery from Deuk Spine Institute yesterday, and one of the surgeries we did was this gentleman here, and he had 2 disc herniations in his lower back fixed with the Deuk laser disc repair. One of them was a bear of a disc. It took us a long time to work on, chipping away at it. It was socked in with scar tissue, and it was not easy to get out, and it was at L5S1, so that's the hardest level to get, and it was very medial. So he's here to tell his story. What brought you to Deuk Spine Institute?
The reason I decided to come here was because of the process being minimally invasive, and one of the biggest, most important factors for me was that no bone was going to be cut or drilled.
That's important. A lot of surgeons don't tell their patients about drilling holes in the spine and removing part of the lamina and facet joint. The facet joint is very important, right? It stabilizes your spine. And you're an athlete. You're a professional sailor. I know you're a competitive sailor.
Yeah.
And so you didn't want your spine getting weakened. So how was your experience? You had surgery yesterday. How are you feeling today?
I feel a lot better today than I did yesterday already. The tingling and pain that was in my leg is gone. Still have a little bit of numbness, but even my back where the procedure was done, I don't have any more pain than I did yesterday. It's maybe about the same, but feels slightly different. So a lot better than I was yesterday for sure.
Now we got you in the operating room. We knew we were going to be treating 2 discs, L45, L5S1. L5S1 primarily because it was crushing your nerve going down your leg. So that's why your leg's better. We were able to get most of it out. But at L45 we were a bit surprised that you had a lot of back pain, right?
Yeah.
When we tested that disc. So do you notice any difference in the back pain today compared to before surgery?
Yeah, the back pain is reduced. I think the main sensation I have in my back is a little soreness from the surgery, but the pain that I felt before, I'm not noticing any.
Yeah, it's gone.
Yeah.
Yeah, so a lot of people don't know that back pain can be cured. It can, with the right treatment.
Yeah.
All right, so your lovely wife is here. You have kids at home. You guys traveled across the state to have your surgery done here. What are your plans for the rest of the weekend?
Take it easy, but get out and around with the kids, because for the past 3 weeks I've been mostly laying in bed, getting up and visiting with the kids as long as I could, which was usually 20 minutes, and I'd have to lay back down because my back would be hurting too much.
And talk to us about that, because that's something that I talk about a lot with our viewers, is how chronic back or neck pain robs people of the quality of their life. It robs them of their dignity, basically, being able to do things with your kids. Hey, dad's in bed again. I mean, that's a horrible feeling, right? Not being able to interact with your family and your children, your friends.
Oh yeah, and my son's very affectionate and loves to hug, and he would always come home and say, "Is your back better?" And I'd say, "No, buddy, not yet," and he'd give me a really gentle hug, and so it really affected even the way we interact. But in general, time spent with everybody in my family was dramatically decreased, because I would usually lay in the bedroom and everybody else would be out in the living room. So with the exception of a couple family nights we put together to watch a movie, so they could all come in and lay in bed and watch TV.
Yeah. So can you imagine living like that for years?
I couldn't. I was going out of my mind, stir crazy, in the since I had the exaggerated injury, I had 3 weeks laying there, and I was going out of my mind with 3 weeks of dealing with it.
What would you tell people who are suffering with back pain or leg pain? What would you tell them?
I'd say go out, give Deuk Spine Institute a call, and get it fixed sooner than later and get your life back.
All right, one last thing I want to ask you. I know that you race competitively. We talked a few minutes ago about that. Tell us, what's the name of your team?
Oh, we don't really have a team name per se.
All right. What's the name of the boat?
The boat is Prime Plus.
Prime Plus. All right. So you have a sponsor?
No, well, the owner of the boat contributes his boat for the racing, and that's what the team races.
Got it.
And
Got it.
Primarily in the Tampa Bay area.
Very nice. Very nice. So are you guys pretty competitive?
Yeah, I'm new to the team on this level of racing, and they have been 3 years in a row. I believe the top boat in the league.
Wow. Very good. Well, we're hoping to get you back to that pretty quick.
Yeah, me too.
All right. Anything else you want to say to the rest of the world? This is your chance.
That covers it. Don't deal with back pain. Get it fixed.
All right. Very good. Well, congratulations.
Thank
Safe
you.
travels home, okay?
All right.
All right.